My name is Dr. Lamin Jaiteh. I am a consultant general surgeon at the Edward Francis Small Teaching Hospital in Banjul, the Gambia. I'm also a senior lecturer at the School of Medicine and Allied Health Sciences at the University of the Gambia. Underwent the Cancer Access Program of the Merck Foundation, and I did a clinical fellowship in surgical oncology at the Bibara Cancer Institute in Guwahati, Assam. I completed my course in August 2024. I think the clinical fellowship in surgical oncology, for me personally, was a very essential skill to have. Although I did have some surgical oncology training during my residency, this fellowship allowed me to deepen my understanding of oncology in general. So I was able to have hands-on practice when it came to surgical oncology procedures by operating with professors and other colleagues within the Cancer Institute. And it also gave me an opportunity to understand how comprehensive cancer care is given. Because in most countries in Africa, cancer care is still in its infancy. And being trained in an institution where you had not just surgical oncology, but also medical oncology, as well as radiation oncology and palliative care, made me have a better understanding of how cancer patients are treated in whole. Despite the fact that I just finished my training about 2 months ago, once I got back to the Gambia, I was able to meet with hospital management and put in place a plan that will allow us to be able to start a cancer unit. As we all know, cancer care is still developing in Africa, and having a unit to begin with wherein patients with cancer can have some semblance of comprehensive cancer care is very, very essential. I'm also working on helping to develop the capacity of doctors as well as other healthcare professionals within my hospital by organizing training programs that would help the understanding of oncology within my teaching institute. So the course has enabled me to deepen my understanding, both theoretical knowledge, but also clinical and surgical skills. So I'm able to handle cases when it came to cancer care that were more challenging to me before I actually underwent that training. So my patients, in essence, are getting better care because of the training that I was able to have. And this would have a ripple effect, not just on my hospital, but as a nation as well, as I work in the teaching hospital, and most of the complex cases are actually referred to that center. I think this course in oncology, I would recommend to any healthcare professional, because in Africa, we're having a shift from infectious diseases like malaria, tuberculosis, to non-communicable diseases like cancer, diabetes, and hypertension. And I think it's important for the healthcare professionals in Africa to be able to have this sort of training, to be able to face the challenges that come with these emerging conditions. Appreciation goes to the Merck Foundation for this wonderful initiative in helping to upgrade and train professionals in Africa when it comes to specialized areas like oncology. I would also like to extend my gratitude to the Ministry of Health of the Gambia and the First Lady's Office for facilitating this training.